Hello everyone, Assalamualaikum warahmatullahi wabarakatuh. My name is Nabila, I'm from PBI class. Here I want to make a oral reading text for interpretive reading class. The title of my reading today is The Work of the Village Medicine Man. Medicine Man and Modern Doctors. In most urban and suburban areas throughout the world, sick people are taken to a doctor's office or to a hospital for treatment. But among are taken to a doctor, but among tribal and village people in many countries, patients are taken instead to a local medicine man. This medicine man is a combination of a doctor, priest, and psychologist. Some of his folk methods are similar to those of an urban doctor, but most are very much different. The differences in methods is a result of the fact that disease, to the modern scientific mind, is viewed as something natural. It is caused by viruses, bacteria, and other small things that we can't see without a microscope. By contrast, in much of the world, disease is considered to be something supernatural. In other words, sickness is not caused by something physical, but instead is the result of deep danger, broken religious laws, the hatred of enemies, and so on. An urban physician knows how to treat a specific disease. A medicine man, however, treats the whole person and often the patient family and friends as well. Prevention of disease. Of course, there are maybe no need to treatment if people know how to take care of themselves to prevent sickness. A modern physician might tell his patients what to eat, how much to exercise, when how to relax, and the like. A medicine man, on the other hand, tell his patient to wear amulets, special necklace for protection against bad spirits. Nevertheless, in both village and urban societies, people do become ill and sometimes need medical help. The diagnosis. The first step in any treatment, of course, is the diagnosis. The doctor or the medicine man has to find out why the patient is ill and decided what to do about it. For the diagnosis, both ask about symptoms. Is the patient complaining about headaches, stomach ache, insomnia, skin rash? But the similarity in method it ends here. The doctor's next step is to give blood tests, take X-rays, etc. While the medicine man involves supernatural methods, he might ask the patient about his dream, use astrology to find the cause of the problem in the stars, or to go into trance, a condition of deep concentration in which he doesn't function normally in an effort to contract spirits or other beings outside the world. The cure. After the diagnosis comes the cure. In modern medicine, this solution usually means one or more of the following. The same methods that are used for prevention: helpful food, rest, and exercise. Perhaps one bath and massage, drugs, or surgery. Likewise, folk medicines include some of the same cures. As in the diagnosis, however, a medicine man also uses a wide variety of supernatural methods in his cures. Two of the most common are exorcisms and soul hunts. Exorcisms is based on the belief the medicine man performs a number of traditional activities to take prayers are part to take the evil beings out of the victim's body. Songs, dances, and religious prayers are part of any exorcisms, and soul hunts include them as well. In these ceremonies, the medicine man tries to persuade the victim's souls, which are believed to have left their bodies, to return. A typical tribal ceremony. The Ndembu people of Central Africa believe that illness is often the result of the anger of a relative, friend, or enemy. This emotion, they say, causes a tooth to enter the body of the person who is the target of the injury to create disease. When the medicine man decides which body part contains the evil tooth, he calls together two victims, relatives, and friends to watch a ceremony, at the end of which he removes it from the patient's throat, arm, leg, stomach, and etc. Although the patient and the villagers know what has happened, that the tooth has been hidden inside the medicine man's mouth the whole time. The patient is often cured. The Antembu ceremony is typical of treatments around the world, in which stones, insects, or small apples are taken out of sick people. Despite scientific evidence that disproves the effectiveness of such methods, the fact remains that the treatments are often successful, and many villagers prefer to be cured in this way than by a modern physician. And the last one is the success of medicine men. Mean. Scientists ask how medicine men can actually be successful in their treatments to why they are so popular. The answers probably lie in a combination of the following reason. First, supernatural ceremonies are symbolic, and the people who participate in them believe deeply in the symbols. Even Western physicians are agree that patients with deep faith believe in God. Their doctors, the drug they take, image or symbols, will regain their health faster than patients with little hope. Second, ceremonies may be effective because people come together for a common goal. Patients see how many people in their communities care about the cure. In addition, these communal meetings provide socially acceptable opportunities for the people of the village to express what they feel. Social and psychological problems can be solved along with the physical ones of the sick person. Fourth, scientists theorize, theorize that the trans part of the ceremonies produce certain chemicals in the body, which then work to help cure and disease. Finally, many of the medicine man's natural drugs, which come from a nearby forest, jungle, or desert, have been found to be medically effective. Scientists are fascinated by what they learn from the methods of tribal medicines. Okay, I think that's all for the oral reading text. I will review all the text for the next video. Wassalamualaikum warahmatullahi wabarakatuh.